I was born with congenital heart defect of tetralogy of Fallot. We waited until I was 7 years old for my first surgery, and I was fine after that. I was self-regulating, so I was allowed to grow up like everybody else. Around my early 40s, I started to get these weird rhythms with my heart. Had various procedures and devices, pacemaker defibrillator with that. And then recently, all of a sudden, what I thought was just getting older was not. I was getting a little slower and walking a little slower and huffing and puffing, and it turns out that my fully corrected valve was leaking.
With Elinor being in heart failure from significant valve regurgitation, we have a lot of advanced options and therapeutics to help her.
We all got together, decided on what we felt would be the best plan for her evaluations, including an understanding of how well her heart was functioning, how well her valves were functioning.
She has a problem that we see increasingly with patients with this particular abnormality, particularly with that repair as it was done back in those days. Many of them develop a substantial leak of the valve that goes to the lung. She had to have a valve replaced by surgery.
During the surgical intervention, we came up with a cohesive plan to address her arrhythmia needs and optimize her electrical pacing as part of her valve repair.
Elinor's electrical system was completely messed up. And during the surgery, we asked Dr. Perriman to design ablation and do these ablation lesions while inside her heart.
And basically what it does is it creates a maze within the collecting chambers, so the signal can only travel down that particular track.
We reorganized all the system so it can beat in a nice way and organized way.
There was no reason to travel far away when I had phenomenal option of Memorial Hospital with their team right here in South Florida, close to where I lived. It's what you look for as an adult congenital patient. It's rare. When you find this, you're very lucky.
What I tell people like Elinor is that when we restore circulation, they will experience living a life that they really didn't know they could live again.
It worked, and I feel great, and I'm back to exercising and doing everything I wanted to do.